The first recorded instance of this was actually in 1921 in France, when a surgeon was asked by a ballerina to take out some fat from her legs or ankles because she didn't like how her legs looked. This ended up in tragedy. The surgeon damaged the blood vessel to the leg somehow, and the ballerina actually ended up losing her leg due to gangrene. Hey everyone, it's Dr. Shim Ching, and talk to you today about liposuction. This is the most common procedure that I do, and probably the most common procedure for plastic surgeons in the United States and frankly all over the world. It's such a popular procedure. It works so well. It's revolutionized plastic surgery, in my opinion. Has not been around that long, but this is something that is so common, works so well, and so many people can benefit from this procedure. So I'm going to talk about this because I want everybody who's watching this video to know what makes a good liposuction procedure, how to pick your surgeon, what to watch out for, what to ask during your consultation, because the purpose of this video is to educate everybody on what I think about when I do liposuction, so you can draw from my experience of doing this procedure so you can get the very best surgery for yourself. So that's the goal of this. If you like the video, subscribe to our channel, give us some comments down below about your liposuction procedure or what you're interested in, because that'll help us out a lot. So what is liposuction? Liposuction is literally sucking fat out of your body using a suction device. And it sounds really very simple. Fat is very soft, and you can use a metal tube that has a hole on one end to suck the fat out of somebody's body using a small incision. The first recorded instance of this was actually in 1921 in France, when a surgeon was asked by a ballerina to take out some fat from her legs or ankles because she didn't like how her legs looked. This ended up in tragedy. The surgeon damaged the blood vessel to the leg somehow, and the ballerina actually ended up losing her leg due to gangrene. It took about 60 years after that happened to really renew the interest in doing this. And it was really only until the 1980s when people started devising ways of doing this procedure safely and effectively. From initially a very unsafe procedure where the results were very mixed and not very good, we perfected this technique over the years so that we use tiny incisions. It's very minimally invasive surgery. We can sculpt the body very precisely, and people are experiencing great results, and it's a very safe procedure nowadays. A little bit about myself. I'm a plastic surgeon. I'm based in Honolulu. I do practice in the Middle East, in Dubai and Doha. I've been in practice for 20 years. I've been doing plastic surgery for almost 30 years, and I've done about 25,000 procedures in my career. So I feel I'm very qualified to be talking to you about this subject and other subjects in plastic surgery. We're using this long metal tube, kind of like a straw, and we're connecting that to a suction device, and that suction and that little hole on the end of the metal tube is what we use to draw the fat out of the body. Kind of like a straw, and we're connecting that to a suction device, and that suction and that little hole on the end of the metal tube is what we use to draw the fat out of the body. This is truly like sculpting the body, and I really like to look at it that way. It's not just simply removal of a bunch of fat from a little area of the body. We really need to sculpt the body so that the effect looks natural, the patient looks better. We can reshape the body in the way that the patient wants. Now, sometimes we actually take that fat and we put it in other places, and that's what we call a BBL, or fat grafting to the breast. So we actually can use that fat, but most of the time in liposuction, we're just taking that fat and discarding it because the patient doesn't need it. Although this surgery sounds simple, just like everything in plastic surgery, you can do it well or you can do it not so well. And it's really the details that distinguish a great result from an okay result. I myself make the smallest incisions, smallest scars possible. I try to hide them, just like I do with my breast augmentations. I like to call that a scarless procedure because we hide the incisions and we hide the scars so you can't see them. Same thing with liposuction. I want the scars to be hidden. I want this to be a scarless procedure. That's the ideal result in my mind. Scars can be placed in a smooth area of the skin, which is very visible when a patient is wearing minimal clothing, and that's really the last thing a patient wants. I'm talking about scars in front of the abdomen or in the middle of the back, just an area that a woman might expose either at the beach or in a certain gown or dress. For example, in the abdominal area, which is probably the most common area that I do, I use 2 incisions, 2 in the pubic area, usually hidden by a bikini, in an area that isn't going to be seen, inside the groin crease, so it's not right in the crease, because if you put an incision in that crease, it can be visible if somebody's wearing a smaller swimsuit. And then I put 1 inside the belly button. So those 3 incisions will allow me to take out all the fat in the abdominal area. If we extend that into the flank area, which is a very common area for me to do with the abdomen, there's 1 single incision at the top of the crease between the 2 sides. Very hidden, not visible, and those are areas that heal very well. Each incision is only 2 millimeters long. I stretch that incision out a little bit so that I can put in a larger instrument, but the instruments I'm using are really quite small. Usually the typical cannula or that metal tube that I'm using is 4 millimeters in diameter, so half a centimeter in diameter. So again, very, very small. So that's the first thing. Know where your scars are going to be from the procedure by asking your surgeon where they're going to be, how long they're going to be, and how many of them there will be. When the fat is removed from your body, it has to be removed in a very gradual way without any sharp transitions, and not too much fat can be taken out of a certain area. The fat removal has to be deep enough so that you don't have little marks on the skin, and in plastic surgery, we call those contour irregularities. And that's basically what happens when the fat is removed too close to the surface of the skin. If you remove fat too close to the surface of the skin, it will get indentations. It'll look like liposuction has been done. The skin will look regular. It won't look smooth. So I think the best way to avoid that is to pick a surgeon who has good results online. Their website shows great results from liposuction before and after. They've done thousands of these procedures like me, and is very comfortable doing liposuction. If you choose somebody who just doesn't do this very often, I think the risk of those kind of contour irregularities are going to be much higher. Another issue that I often see, which is asymmetry. So you have your left and right sides, and usually when we do liposuction, we're doing the left and right side of the body, and we need to match the 2 sides so that they look even. So I take the time to mark a patient's body when they're standing, so I know exactly where the fat is when I'm working on the patient and the patient is lying down. I can also examine the body to see if one side of the body is bigger than the other, so I know if I need to take a little bit more out of the left side or the right side to compensate for that. The other thing I do, and not all surgeons do this, I think it's super important, is I measure the amount of fluid that goes in, the numbing fluid, so I know exactly how much goes in. And then I measure the fat and the fluid that comes out, so I can start to take the same amount from both sides. And if I need to make adjustments based on the patient's body, I could take a little bit more from one side or the other. The last thing I'm going to talk about is there are so many different types of liposuction. There's so many things attached to liposuction that makes people very confused about the kind of liposuction they're going to get. So the things I'm talking about are VASER, J-plasma, body tight, power-assisted liposuction, ultrasonic liposuction. There's just all these sort of names attached to liposuction. And I can tell you that in the end, it really is the skill of the surgeon that matters more than the device itself. Now, you may hear that VASER is the best way to get liposuction, but I can tell you that it isn't. It's just a tool, just like a hammer or a knife. And even though you can buy the most expensive tool out there, you still have to have somebody who's skilled enough to use it. These devices, these lasers, these things, they don't do the surgery for the surgeon. The surgeon still has to do the surgery. A good surgeon can do liposuction without any of these fancy tools. I myself use 2 things that I feel, really make the surgery better. One is I use a laser for liposuction that's called SmartLipo, which is a laser device that melts fat before we take it out, and it does offer some skin tightening. And then I use something called power-assisted liposuction, where the metal tube that I use to extract the fat vibrates. And that vibration makes the removal of fat more gentle. And I can do specific things when I sculpt the body that I can't do without it. So please don't think just because somebody has a fancy device that the surgery will be better. The most important factor is going to be the surgeon, their skill and experience. If you're thinking about liposuction, I hope this video helps. If you have any questions, please give me a comment down below and I'll be sure to answer. Thanks so much for listening, and we'll talk to you next time.